Welcome back. This is Dr. David Cruz here with White Coat Medicine Talks. Today, I want to talk about low back pain. Say, for instance, you're outside, I don't know, just planting things, red tips, or anything like that. And say, for instance, that you're bending over and suddenly you get a back spasm. Now, what are you going to do? Other than stop planting stuff, you're probably going to try to stay down or get up or do something and try to get that pain to go away as fast as possible. So these are probably the first steps that you want to do initially. Of course, always check with your doctor and get treatment from your doctor, but these are some of the things that you might want to do initially. So what I would do is initially start stretching. Stretch those muscles out as fast as you can. So slowly get that stretch in so that those muscles stop spasming so much. Make sure you're well hydrated. Make sure you're drinking lots of fluids. And then after that, take some anti-inflammatories. So my choice is usually ibuprofen, 800 milligrams. You can take that every 8 hours. And these are things that usually people can have at home, which is like Advil or ibuprofen over the counter. And if you do that, that's going to be a good first start. But in addition to the stretching, you want to do some heat, and the heat is probably an all-day thing. The more heat you put on it, the less stress on your muscles. They start relaxing more over time, and that will help you get better. Now, if you have access to a TENS unit that give you electrical stimulation to the area, that might be very beneficial as well, because your muscles will again start relaxing even more. If there's anybody to give you a massage to put pressure over those areas that are specifically spasmed, that will give you more benefit right away. Now, when you do have access to other medications, sometimes I give steroids, and steroids will decrease the swelling faster. And in addition, sometimes people will take muscle relaxants as well. It just depends how you do. Having a good support belt will help you get around those first few days possibly. Now, if it's just spasms, they tend to go away in a few days, maybe a week. But the faster you get to treat them, the faster they will go away. I don't believe in just rest. If you're in bed rest, you're probably going to get worse, and you're not going to get better as fast as you can. Stretching, moving, getting everything done as best as you can is the best thing for it. Now, there is a different type of back pains. There is those back spasms that are muscles that run right along the side of the vertebrae, and they get very tender and tight, and that pain is terrible. You can't do much. But you also can have radicular pain, which means you're having pain running down your leg. Now, that is a little bit different, and if those symptoms persist greater than a week or 2 weeks, then you may have to get an evaluation at that time with an MRI. We don't always do x-rays or MRIs initially. Partly is because x-rays don't necessarily help us in the treatment. The initial treatment is going to be conservative, and you want to get that done first. So don't listen to those people telling you need an MRI, you need an x-ray, you need this, you need that, and then get frustrated because you're not getting that type of service. As doctors, we have to make sure that we're doing the right test at the right time and doing the right type of procedures and treatments initially. And that doesn't always include x-rays. X-rays only help us some, not always in every case. So, after a month's time, you're still having pain, you're probably going to get an x-ray. You might get an MRI before that or x-rays before that if you do have radicular pain or any other symptoms of, say, for instance, you can't control your bowel or bladder habits and you have incontinence of some reason. That means that there's some nerve damage. You're definitely going to get some x-rays and MRIs prior to that. But for simple back pain, these are the initial treatments that we would do. It's conservative, but mostly beneficial, and your pains should subside. Talk to your doctor about this, and it's been great to talk to you one more time, and we'll see you soon. Take care.